Gout is a prevalent type of arthritis that causes excruciating pain and typically affects only one joint at a time, most often the big toe. Periodically, gout flare-ups can cause the pain to become more intense. On the other hand, there are moments when no symptoms occur at all. If left untreated, recurrent bouts of gout can worsen into a more severe form known as gouty arthritis. While there is no definitive cure for gout, you can take control and manage your symptoms through medication and lifestyle changes. The non-athlete fitness team has put together in this video for you another resource for the top things you should know about gout. Gout signs and symptoms. Gout flare-ups can begin abruptly and have the potential to linger for days or even weeks. After a flare-up occurs, extended periods of remission can follow. It can be weeks, months, or even years before another flare-up. Gout commonly affects a single joint, most often the big toe. Apart from the big toe, other joints frequently affected are those of the lesser toes, as well as your ankles and knees. The joint or joints affected may cause significant discomfort. Other symptoms may include intense pain, swelling and inflammation of the area, visible redness or discoloration of the skin surrounding it, or heat radiating from the site. Causes of gout. Hyperuricemia, a condition that causes an excess of uric acid in the body, is responsible for gout. When your body metabolizes purines, which can be found both internally and in certain foods you consume, it produces uric acid. When the uric acid levels in our body become too high, monosodium urate crystals can develop and accumulate in fluid, tissue, and joints. Although hyperuricemia is a factor in the development of gout, it does not always lead to symptoms. Thus, there is no need for treatment if you do not exhibit signs and/or symptoms of gout due to high levels of uric acid. Who is likely to get gout? You are more likely to develop hyperuricemia, the root cause of gout, if any of these apply. Number 1. Certain health conditions. If you have one of the following health conditions: congestive heart failure, hypertension, insulin resistance, metabolic syndrome, diabetes, or poor kidney function, you are more likely to develop gout. Number 2. Being male. Gout is more common in males due to the lower uric acid levels present within female bodies. With menopause, however, women's uric acid concentrations approach those conventionally found inside male systems. Number 3. A high purine diet. Eating a diet that is high in purines can lead to an overload of uric acid for your body. Red meat, organ meat, and some types of seafood like anchovies, sardines, mussels, scallops, trout, and tuna are all known as purine-rich foods which should be avoided or limited when possible. Number 4. Specific medications. Utilizing specific medications, like diuretics, can increase your likelihood of developing gout. Number 5. Alcohol consumption. As alcohol consumption increases, so too does your risk of developing gout. Number 6. A high sugar diet. As the body digests fructose, purines are released. These chemical compounds form uric acid, the substance responsible for creating harmful crystals in our joints and causing gout. Number 7. Being obese. Research suggests there is a link between high BMI and the risk of gout due to an elevated serum uric acid level. Hyperuricemia has been shown to be correlated with obesity, as it can elevate urate production while limiting its renal excretion. How do you diagnose gout? A medical doctor can accurately diagnose gout by taking into consideration your symptoms, as well as the results of physical examinations, X-rays, and lab tests. When a joint becomes inflamed, swollen, and painful during a flare-up, the diagnosis for gout can be confirmed through lab tests that reveal uric acid crystals. Ways to manage gout. Gout can be a highly disruptive force in our lives. Thankfully, there are cost-effective self-management strategies that have been proven by researchers to profoundly improve the quality of life for those who suffer from gout, such as: Number 1. Eat a healthy diet. To ward off a gout flare-up, it is wise to reduce your consumption of foods high in purines such as red meat, organ meat, and seafood. Furthermore, limit intake of alcoholic beverages, particularly beer and hard liquor, for the best result. Number 2. Learn to manage your gout. Enhance your knowledge of arthritis and other chronic ailments, like gout, by joining a self-management education class. Watching more videos from the Non-Athlete Fitness channel can also help you with that. You'll gain valuable insights on how these conditions can affect your life while gaining the confidence to take control of your symptoms and live life to its fullest potential. Number 3. Maintain an active lifestyle. Health professionals suggest that adults participate in at least 150 minutes of moderate physical activity every week to reap its numerous benefits. Every moment of exercise matters, and any amount is better than none. Taking a stroll, swimming laps, or cycling are all great examples of low-impact activities you can do to stay active. Dedicating time to regular exercise can drastically reduce your risk for developing serious and potentially life-threatening conditions like heart disease, stroke, or diabetes. Number 4. Take classes. If you are hesitant to pursue physical activity due to concerns that it will worsen your arthritis, fear not. Participation in exercise programs can greatly reduce pain and disability associated with the condition as well as improve mental well-being and mobility. Struggling with arthritis can be difficult, but classes offered at area YMCAs, parks, and community centers are here to help. Through these specialized sessions tailored for people dealing with the effects of this condition, you can begin your journey towards feeling better. Number 5. Consult a physician. By attending scheduled appointments with healthcare providers and adhering to the recommended treatment plan, you can take charge of your arthritis and reduce its severity. If you are dealing with other health issues like diabetes or heart disease, this knowledge is especially crucial. Number 6. Lose some weight. For those who are overweight or obese, shedding pounds can significantly lessen the load on weight-bearing joints such as the hips and knees, thus reducing discomfort while increasing mobility. By either reaching or maintaining a healthy weight, you can alleviate the discomfort associated with arthritis, improve your mobility, and slow down its progression. Number 7. Reduce stress on your joints. Joint injuries can bring about or exacerbate arthritis. Thus, it is paramount to select activities that are gentle on the joints like walking, cycling, and swimming. These low-impact exercises are highly safe, enabling your body to move without excessive pressure on the joints or muscles. So there you have it. To ensure proper treatment, a doctor or healthcare team specializing in gout should diagnose and care for this condition. As warning signs of gout can be easily mistaken for other forms of inflammation, proper diagnosis is essential in order to identify the issue. Rheumatologists are the skilled physicians who specialize in treating gout and other forms of arthritis. After a rheumatologist has identified and remedied your gout, it is usually taken over by a primary care provider to continue monitoring the condition and helping you manage it. Want to learn more? Be sure to check out the other videos on our channel and the resources below to help improve your health and fitness. Until next time.